a digital workflow and possibly work from home, or how that fits with telemedicine. Well, today I've got a great friend of mine, Dr. Larry Emmott, who is brilliant on how all of this works. So you're going to love this episode. Do me a favor, grab a pen and hit the share button. You're in for a treat. Here comes the video. Video's back on. Hey guys, welcome back to the Best Practice Show. My name is Kirk Behrendt. I am your host, and I am so excited. I'm just glad you're here today. And if you're here for the first time, I want to do two things. Number one, I just want to welcome you to showing up to a great community where there's no egos here. We're just to learn and have some great fun and give you some great information from key opinion leaders in dentistry, just like Larry today, so that you can go back and create a better practice and a better life and even work from home. Wouldn't that be cool? So he's going to give us some insights on that. And also, if you're here for the first time, I want to encourage you to just hit the subscribe button below. I don't care if you're listening to iTunes, Stitcher, Google Play, whatever. Go right to the subscribe button, hit the subscribe button, because I want you to show up every single week as we bring another key opinion thought leader in dentistry to give you some great information. You don't have to figure out all this stuff on your own. There's people that have figured out a lot of this, and it's awesome learning. Also, if you haven't joined our private Facebook group, I'm going to invite you to come on over there. It's awesome. I don't even really know how they work. I'm starting to learn how they work, but we started it last year in the COVID conference as just a support effort for dentists to reach out to other dentists and team members alike when they had questions about things. So the best practices powered by Act Dental, there's over 13,000 of you in there. Just join us over there where the conversation always continues. And then lastly, we take a lot of show notes here at Act Dental. So everything Larry and I talk about, you're going to see. I'm going to give it to our writers, and our writers are going to write all these things up. They'll put in links to Larry's blog, which you have to follow. And then anything else, just flip it up, go right to the show notes, and there'll be a link, and we'll take you right to it. So I want to jump into this. Larry, I want to talk about who you are first. I have known you forever. And you're kind of one of those people that's always on the circuit. You've been out teaching. You were teaching technology before it was cool. And I want you to share, who is Dr. Larry Emmott? What do you do? How do you do it? I always like people to know who they're listening to before we get into the topic.
Thank you, Kurt. You know what? You kind of exposed me. I'm an old guy, which is kind of funny because I'm teaching technology to these young people that are supposed to be the tech people, and they just, anyway. But yeah, I've been doing this for a long time, having a great time doing it. You get a kick out of this. When I first started telling dentists how to use technology, it was like, how do you use a mouse? I mean, it goes back that far. And having people understand that technology isn't something extra. It's actually what makes your practice thrive and what makes your practice run. So first of all, I must say I'm no longer practicing. I have sold my practice, but I was a practicing dentist for 30-some years. I've been teaching dentists how to use technology effectively for most of that time, 20-some years. Like I said, going back to the early days of Macintoshes and mouses. And actually, my very first computer system was one of those old, like Winchester Drive Unix machines. So I've had a great interest in technology. And part of that was seeing dentists being taken advantage of by technology vendors. Sometimes because people just didn't know what they were doing. I thought, this is an area that I can be helpful, help dentists. It's an area that the future is going to be. So it's been a wonderful time going from mouses to now the internet and the cloud and just all this amazing stuff. So it's been a great ride, and I'm still enjoying every minute of it.
That is so cool. And I want you to talk about this. When it comes to technology, the digital workflow, everyone loves talking about it. Very few people doing it really well. We're going to talk about that. Also, I'd love for you to talk about the disruption of the pandemic. I didn't really know what telemedicine was. I mean, I had heard the concept, but now people are stepping into it. And now you're going to introduce a third component that really increases the complexity, which is dentists can work from home now. So let's talk about the why before the how. Why is this such an important topic right now?
Yeah, I would even like to go back even like one step back and kind of just take a look at things. So obviously for the last, since March, so 9 months, 10 months, we've been dealing with the pandemic and all the issues we've had to do to deal with that. And I know people like to complain, but I think the society's done a remarkable job. Having said that, many of the things which we do now that allows us to do this, to have school from home, to work from home, to communicate, to stream movies from Netflix, all of that stuff has to do with the infrastructure of the high-tech world we now live in. If we'd been faced with this same issue just 20 years ago, in the 1990s, it would have been completely different. We wouldn't have been able to do all the things that we do. And somehow we almost just take it for granted that, of course, I stream a movie. But that's not something we used to do. But it allows us to do these things. So anyway, the technology infrastructure, which we've used in our general lives and society in general to deal with the pandemic and some of the issues of social distancing and staying at home and avoiding crowds, all of that stuff can now be transferred into our dental practices as well. Right. So that's kind of an underlying thought, a way to think about it. Right. Now, what was the question you asked me about? What about?
Okay, so let's define all three and how you see them, and then how they work together. So, first of all, how do you see digital dentistry? Everybody has a different take on digital dentistry. How do you define digital dentistry? And then let's go to the next one, which is telemedicine, because how this is telemedicine. I don't know. Like, let's start with the first, the second, and the third, and then we're going to combine them.
So one of the things that I've been working with dentists for 20 years, more than that, is digital records, paperless records, we call them, or the front deskless office. By the way, I probably should note, the person that coined that phrase, front desklessness, was Dr. Omar Reed. Right. One of the most amazing dentists. Who sadly passed away just about a year ago at the age of 80, and still an influencer. And the fact is that many of our younger colleagues don't know the name Omar Reed, yet I guarantee you how you practice today was influenced by Dr. Omar Reed. And he made a comment of the front deskless office, which sometimes drives people the wrong way, but I think the paperless office or the paperless record. So I personally went paperless in my office in the 90s, again, well over 20 years ago, 1995 or something like that. We got rid of our charts. And I've been trying to help dentists do that ever since. But the steps there's really kind of steps to this. And the first one, of course, I have paper everywhere. We all used to have that back in, that's 1960s. Then the next step is what I call hybrid. And this is sadly where I think most dentists still are, where they have some things on paper and they have some things in the computer. So they might have a computerized chart, but they write prescriptions on paper, or they might put their treatment plan on paper, or they might schedule on paper, but chart, anyway, that kind of stuff. That's the hybrid. The next step is the digital records. And that's a huge step. We actually get rid of those paper charts, and I have everything now on my digital record. And that's a great start. But people get stuck there too because they think that's the end of it, but it's not. Right. The next step is digital workflow, where I take this new technology I have, everything electronic, everything digital, and I now start to do things differently because I can. Right. And up until 2020, I was basically talking to people how I could streamline the flow of work in the dental office. But the fact is that because it's electronic and digital, I can do this same work not in the office. You don't have to go in the office to answer the telephones. You don't have to go to the office to send insurance forms. All of that stuff can be done electronically from work at home. So that's kind of the basic underlying thought that I have for that.
Right. Now, I want to ask you a couple of questions on that. You were describing the steps. Do you see those as a linear progression? Because first of all, it's the law. You have to go in the digital. And do you find a lot of dentists go the reverse way? CBCT first, and then like they buy the technology and then they work upstream the wrong way?
Yeah. Well, let me ask you a question, because you visit with far more dentists in their offices than I do. I've been trying to get a handle on the number of dentists that are actually paperless, that really don't have paper charts. And it's a hard number to get. When I ask my audiences, and it's beginning over 50% now. But I think I have a self-selected audience. You know what? And so do you. I mean, you are so good at what you do. I know the people that choose you are advanced offices. But having said that, what's your experience? What's your percentage of paperless?
Okay, so I'm very biased. And so you're asking me a loaded question. I feel like people just answer how they want to answer. It's like this one. 25 years of doing this. People go, I'm fee for service. I only take 3 PPOs. I'm like, that's not how I'm only on 3 of them. I'm like, that's not fee for service. They're like, well, I don't. And I'm like, oh my gosh, people are defined. And then they go, here's another one. So I can't even answer your question. People go, I'm paperless. Well, then you go to the office and there's stacks of paper everywhere. I'm like, is it part of the office is paperless? You know, the poor woman at the front has a stack of paper and somehow they're paperless. So I feel like what you're asking, I can't even answer. I don't even I don't even have a template to give you. I just know that people resist to do it because of what they don't know. They feel fearful, or they're subscribing to the 7 most expensive words in business, which is, this is the way we've always done it. Judy's not going to like this. And that becomes a barrier. But Larry, you see this. Once they get to it, they go, I can't even believe we used to do it that way. Right?
Well, let's do a real quick thing, Kurt. I've been doing this so long. I was in dentistry back when we used to have a paper schedule.
What?
Oh, yes. We would take a piece of paper and write the schedule on it. Like at 9 o'clock, we're going to see Mr. Jones. And when we made this first transition, this is one of the first technical transitions that we made in dentistry. We went from a paper book to an electronic schedule, exactly the same resistance. No, doctor, I don't want to do it. It takes too much time. It's too hard. Let's go back to the way we've always done it. Now, you couldn't find a front desk person. You know, they would slit their throats before they'd go back to a paper schedule. Right. And we're kind of in the same phase right now with paper charts. Sometimes it's the dentist, sometimes it's the administrator, sometimes it's the assistants, but people are they're afraid of it. In fact, I've identified what I think of as 3 barriers to this, to going to electronic digital. So digital records leads to digital workflow, which is, of course, where we're going to go with this. But barrier number 1 is what you already mentioned. That's the way we've always done it. I hadn't heard that before, the 7 most expensive words. That's wonderful. And barrier number 2 is the same but not, and that's just change. And, you know, it's been said that people fear change. I'm not sure fear is a good word, but they certainly do resist change. And I've read a lot about it because it's one of the main things I try and do is help people change and help them get through that thing. I know that's a main thing you must do too. And one of the things I read talked about why people resist change, and there were 2 things that popped up that I hadn't thought about before. And one thing is people resist change because it threatens their self-image. And they fear a loss of status. Yes. And so, you know, they're like, say, those paper charts. I remember one office, I went in and helped them go paperless, and the woman at the end of my consulting said, oh, Dr. Emmott, that's fine, but I like my charts. I like pulling charts. And I thought, does she really like that mindless task? And I thought, no, but she's invested in it. She invented that system. She maintains that system. She relates to the patients through that system. It's how she creates worth for herself. And so when that status is threatened, then she's going to push back on it. And so one of the things I want the dentist and the staff to understand, team members understand, is that when you're dealing with change, those are the things that you have to deal with. There's more psychological stuff. And so helping support them, helping them make sure they'll be valuable, in fact, more valuable after the transition, I think is important. And do team members ever listen to this?
Yes, they do. And
okay, well, I don't know if we can tell them this next part. It's kind of secret. But one of the things that I transitioned to, I've been talking about for the last couple of years, is what I call the practice technologist. And that's the person that does all this stuff and knows how to do it, doesn't think of it as a burden. It's not an extra. It's the way you run the practice. Of course, I'm going to do things online. Of course, I'm going to use electronic services. Of course, I'm going to do that. That's just the way you run your business. Sadly, many business administrators still say, well, the way we do it's on paper, but the doctor makes me do this electronic thing, and that's like an extra. No, it's not. Now, here's the part that, so team members, stop. I want you to stop listening now. This is just for doctors. Doctors, if you have good electronic systems, you can do more with fewer people. You can reduce the number of people in your office by at least 2 or 3 people. Let's say just 2 people. If you had 2 salaries less and you could do just as much or more work, what would that do for your profitability? So if your staff person think their job is answering the phone, filling out forms, sending insurance forms, that kind of stuff, they were a great staff member back last century, in the 1900s. They're not anymore. So, okay. All right, enough of that. Forget that. Okay.
Oh, wait.
You can start listening again.
Yeah, but go back to one thing. I thought that was really good what you said. Like, I think that can't be said enough. We have to really understand this, you know, the nature of change. You said, what we don't understand, maybe as a dentist or as a coach, is that it affects their self-image. They have been able to create value through the paper, through the chart, through this. And all too often, a dentist will throw somebody underneath the bus and go, oh, they're not just into change. I think they got to be a little bit more open, or a little bit more, understanding, I would say, of like, nobody really likes change. And I was joking with like, I got the Apple Watch. It asks you which wrist you're supposed to put it on. Well, I put it on the right one, and I'm like, I can't. I hated putting it on the right, so I put it on the left. Change is hard. It really is, and I think we just got to be a little bit understanding on that. So, what do you got there? You got the Apple Watch, yeah?
No, mine's an Android watch.
Oh, yours is an Android? Okay.
Right. My wife has an Apple Watch. I have an Android. We have a mixed marriage. It's challenging.
So,
but it's brand new. I just got it for Christmas.
I love how you've laid out the digital workflow. Now, I also want you to define telemedicine, because even now people are still is it a hot thing? Is it a fad? Is it here to stay? You get to see all this. What's the current state of telemedicine?
Yeah, well, it grows from this digital records, which goes to digital workflow. And part of it, that we're on the cusp of real telemedicine, teledentistry. But there's a lot of work from home things that we can do, which you might kind of think of maybe teledentistry in the sense that it's business, and we can do things from home. But it all stems back from this ability to do the ability to work from home. And before I forget to, I want to say there has been resistance to telemedicine, not simply from dentists, but from the world. Right. For example, I worked for a while. The last clinical thing I did a couple of years ago, I had a great time working in sleep medicine, and really helped a lot of people. And of course, as everybody knows, sleep medicine is actually a medical condition, and you must get a medical doctor involved with your diagnosis and treatment planning, all that kind of stuff. And very often, for a typical dental office, they're off to the sleep doctor, you never see them again, or it's a barrier. So we dealt with it through telemedicine. So the patient would go to the dental office. We would then we had it all set up ahead of time with the sleep doctor. They would sit in front of their computer. We'd do a Zoom call, kind of like this, except it was medically encrypted. So the doctor's on one end, my patient is on the other end in my office. They never leave my office. They do the consultation. We gather the information for the doctor, the physician doctor, the sleep doctor, as far as their scores, the things you need to do for sleep medicine. The patient could do a take-home sleep study, which was, again, digital, electronic, through the internet to the doctor. They would do a telemedicine interview on the patient in my office. They do a digital sleep study overnight that was sent to them online. They could then do a diagnosis from wherever. They were not in the state of Arizona where I live, and the sleep doctor. Then they would send us a prescription if they thought it was appropriate for a oral appliance for this patient to help with their sleep medicine. A wonderful example of the use of telemedicine. However, certain insurance companies, which go by the acronym of Medicare, wouldn't pay for it. So if you're over 65, and a lot of apnea patients are over 65, we couldn't do that system. Right. We had to send them away, so it cost them more to go to the doctor, the physician's office. They had to make another appointment, had to travel, park, whatever, take time. Well, 65 did not to maybe not work, but anyway, all kinds of extra things that were a barrier to us because the insurance companies didn't want to pay for telemedicine, and there was a problem. Having said that, with the pandemic, it has forced both the insurers and the government and the dental society to start recognizing some of these things.
Right.
Having said that, I'm still very disappointed in the way the dental society is approaching telemedicine. That's another. Well, we'll get into that. I want to hear why I don't like the dental society.
Oh, you can just go there. It doesn't matter. This is an open forum. I want you to go back there. Has it influenced it in a big way? Like, what really has happened in the pandemic? I mean, from percentage standpoint, because I don't have any idea of like what percent. I've watched some dentists do this. They're thinking differently. They're doing the telemedicine. They're doing the consults. They're outsourcing even the phone calls from their practice so that they can I think it's all open now. It's like an open source system. So go back to that. Teledentistry, is it a big thing now? And also couple that with this. What's the future look like for telemedicine?
Well, I think the future is huge.
Why?
Having said that, well, let's go another couple of things. Dentistry is on the periphery of what's commonly referred to as the healthcare crisis. And if you study what we've been dealing with for the last whatever many years, the so-called crisis isn't in healthcare. It's not the care. We have amazingly good care for the most part. The crisis is in affordability. It just costs too darn much money to get sick in America. And that's the crisis. And so whether or not you have insurance or whether or not it's covered or whether, all that kind of stuff, that's the so-called crisis. And again, it's not care, it's affordability. Telemedicine will allow us to do things in a more affordable way. And if we can do that, that deals with this crisis. So it will allow it. So that's one of the big reasons. For example, now this isn't dentistry, but it's, I think, a wonderful example. There's been a number of studies done which indicate that using your cell phone, that I can take my smartphone, again, an Android, I'm, mixed marriage. I can take my Android cell phone. If I have a skin lesion, say there's something unusual there, I can take a picture of it, send it up to the artificial intelligence in the sky. They will analyze it and actually have found that the AI, artificial intelligence, analyzing the image is more accurate than a board of dermatologists.
Whoa.
So what does that mean? Now, again, this is hypothetical. This is a future, but you want to know the future. So here it is. So my name is Larry, and I have skin issues, and I noticed this unusual issue, think, that looks scary. I need to get it checked out. What would that mean? You have to take some time, call the dermatologist, wait on hold, eventually get an appointment, probably 2 or 3 weeks down the road, take time off work. If I'm a young person, get a babysitter, whatever, drive there, find a parking spot, maybe you have to pay for parking, wait in the waiting room, fill out all those paper forms. The physicians are way behind us, by the way, way behind dentists as far as forms are concerned. Fill out all the paper forms, wait to be seen. Doctor comes in, looks, says, yeah, you know what? I'm not too worried about that. Keep an eye on it, of course, but I don't think it's a problem. Okay, fine. So I go out front, fill out the paperwork. We start the dance with the insurance company. Who's going to pay what? What do I pay? What's the copay? That kind of stuff. 2 or 3 months later, we finally find out who pays what. That's our current. And by the way, that physician, the skin doctor, has to charge at least a couple $100 for the office visit because they've got to cover all their overhead.
Right.
Okay, that's our current system. New system. Larry sees this lesion. I'm kind of worried about that. Click, cloud, artificial intelligence. 1, 2, 3 minutes later. Don't worry about it, Larry. It's not concerned.
You're hurting my brain, and it's
virtually no cost, virtually no time.
It's almost weird that you said dermatologist. I made an appointment. Actually, I didn't do it. My wife did, for my daughter to get in dermatologist. 6 weeks.
Yeah.
6 weeks just to get in. Dermatologist, too busy. So when you're talking about taking a phone, cloud, get results, who isn't going to want to be on that? How does that relate to dentistry? Okay, so talk to me. I'm a 32-year-old restorative dentist with a very busy practice. Larry, how's that relate to me? Do you know what I mean? Like, what can I expect? I want to do this too, but I also want to kind of go back to how we get there, the whole concept of electronic services, because that's really what this kind of is. It's an extension of electronic services and using the internet to do business. Well, here's a simple one. Online or text messaging to remind patients of patients of appointments without a phone call. So back in the day, last century, the 1900s, BC, before computer, you would have a staff member grab the phone, and call every patient on the tomorrow schedule, wait, get put on hold, you have to leave a message, call back because no one answered, blah, blah, blah. Then they did answer and cancel their appointment. That was the way you used to have to do it. So it involved a human being getting data, which was paper charts and paper schedules, doing an action, which is making my phone call to come out with a result, which is a confirmation of the appointment. Right. Now,
of course, we don't have to do that. We do an electronic service, e-services, and there's dozens of them that do reminders now. Smart Reminder was the first one. So what we do now is the computer gets the data in the form of the patient's information, name, and blah, blah, blah. It goes up to the cloud, to some cloud computer. It sorts it all out. It sends a text message that comes out of my phone back to the patient saying, see you tomorrow at 2:30. And it does it every day with every patient, with no person ever picking up a telephone. No human being having to do anything except set it up. And that human being, by the way, is the one I talked about before, the practice technologist that knows how to do all this stuff. So that human being sets it up once and never touches it again. It does everything for you at a very low cost compared to what you pay for a human being. And it does every patient. So that's the concept of an electronic service. Now, to do that, what do you have to have? You have to have digital records. Every patient's name and phone number has to be in the computer. You have to have a digital schedule. Every person who's scheduled the next day has to be on their electronic schedule. And then you have to have an electronic service that's going to put these things together. So that's where digital data leads into digital workflow. So workflow, again, instead of picking up a phone and calling, is electronic reminders. Oh, another one that's huge, payments. I'm amazed at how few dentists have online payments. Well, let me ask you, I mean, you deal with this all the time. What percentage of your clients have I can pay for my bill online?
It was very few before COVID.
Okay.
Then COVID came and it was like, oh my gosh, we got to find a way to do this. And it's really wild how disruptions affect how people think, because now they got to figure it out. So we had so many offices figure out how to do, no touch payment in the back, get patients to be able to pay online in advance. And I was telling them about try to take as much work off of the front desk person as possible. People can schedule and collect payment in the back. And you should see so many dentists are like, no, we would never do that. And when they do it, they go, that's crazy how much easier it is.
And cheaper. And cheaper.
Yeah. And on top of it too, Larry, again, you're hurting my brain because I have teenage daughters at home. They don't use this to make phone calls. Everything is a touch of a button. We do Grubhub and DoorDash for everything. And I actually get upset when it's longer than 55 minutes. I'm like, how good can this business be? I just ordered everything. I didn't talk to anybody. And 55 minutes, are they that busy or do they just not get it? And then I got a bagel place here in town. They don't have an app. They just don't. Well, I mean, I almost said to the woman, you're losing thousands per day.
Yes.
And she's like, no, we don't need an app. We just do it our way. And I'm like, oh my gosh, the line is out the door. So I have thoughts on that, but I agree. We've got to be open to the future. And that's where I think telemedicine is going to be huge in the future. And then I also want you to parlay this because, again, the opportunity to work at home is greater now than ever for dentists. You don't have to be chained to the office on a Sunday to get all this done, do you?
Not at all. And so, we mentioned bill pay, online bill. Again, I get a bill from my dentist and I want to write a check and mail it in. I mean, how 1990s can you get? 1980s. I mean, that's 40 years old. And then, or I call up and wait on hold until I can tell you my number, which means a team member has to answer the phones, cost. Or I go online and go click, and pay like I do everything else, like my Amazon account. I mean, hey, this is the Amazon world. So anyway, so there's reminders, online bill pay, forms. Another one. If you do not have online forms, you're running in last century BC before computer. So, and by the way, when I mean online forms, that's not a PDF of your paper form. It's an actual electronic form that the patient fills out that then populates your electronic chart in your office. No human being has to touch it. If they do a PDF and they have to print it, fill it out by hand, bring it in, give it to a team member who then has to type it in, that's a lateral move. There's been no savings of time. So real online forms. So online bill pay, online forms, online appointments. That's been a huge change. It used to be I could ask a question about an appointment, which was great. Say, can I come in Wednesday at 2? Because that made a commitment to that patient. Oh, by the way, how about commitments? This is huge. So I went to online forms again. I'm a geek. I'm, first adapter, blood bleeding edge. So I had online forms back last century in the 1990s. And when I had a new patient go online to fill out the form, first of all, it was way cool because we were the first in town. But then they came because they had made a commitment to us. Right. They had filled out that form, and they always show, because I'm sure as a consultant, a management consultant, the number one no call, no show is a new patient that doesn't know relationship.
Right.
Fill out that form, they showed up. And of course, as the dentist, I could review the form before they ever got there. If there was a pre-med issue or anything, I knew that was going to happen before they ever got there. They showed up, they were committed. So forms are huge, and real forms, not PDFs. The other thing then is making appointments. So if it's a commitment to say, can I come in Wednesday at 2, and you can do that. And I like that. But the latest one now is actually making an appointment where they actually go onto your Dentrix schedule or whatever schedule automatically. And I think that's enormous. Again, a lot of resistance for that. And you have to be careful because you can't schedule the doctor very well with that, but you can certainly schedule new patients and hygiene automatically without having to worry about, juggling how the schedule fits.
Right. And most all of them have filters where you can decide it's not, you're not just going to open up your schedule to helter skelter in anyone. No, you can open up spots according to the particular appointment they're looking for. And it makes it super easy. And it's crazy. Like we even use it in our personal. I would never want to go, when do you want to come in? Here, let me call you. Let me get back to you, blah, blah, blah. No, people schedule and then there's time allotted and they can go right in there whenever they need to. So
now, how many of your clients are doing that? Are they picking up on it? Are they getting okay with it? Or are they still kind of scared of it?
It's the same thing you've been talking about. Like everyone's like, no. And then when they do it, they're like, holy moly, I had like 19 patients last month, brand new ones, some of them good. Now now it comes to you to think really well when you're getting a lot of calls and a lot of people scheduling. Now we just tighten up the filters. You have to be better about how you use your time in that. But let me go back to something you said. So I totally understand this. I love this, but the online form thing, the PDF thing, that's a mess. So, but a dentist watching this, I understand online forms, but that's hard, Larry. That's hard to develop all that. It's hard. Well, it's hard to stay this way and have people fill it out. Every time you create a system or put in a technology, you save hundreds, if not thousands of hours in the future. Would you agree?
Oh, totally. And so Kirk, you said that too, reminds me. Yes, the forms, you have to one time dedicate maybe an hour and a half to getting them done right, and then you never do it again. It's not like you got to keep on doing it. That reminds me too, the other thing that I've just struggled with for dentists is electronic charting. So I use Dentrix, and I was able to put into my automatic notes. And when I finished whatever I was doing, my crown prep, whatever, went click, and those notes, and they're the best notes you ever written because you wrote them once and never did it again. I just put in the details of how many carpets or whatever, and they were done. But it took me, again, I was a pioneer, so I did this early on, but it took me a little while to do it. But nowadays you could do it in an hour and a half, 2 hours, and you'd never have to do it again. But I see dentists resist it. Say, I don't have time for that. I can't take that time to write all those notes. But they write those stupid paper notes every day, day after day after day after day.
And you can't read them.
Yeah, right. And you can't read them, and they don't really cover you. Anyway.
Yeah.
So that's one of the issues too, as well. It's kind of, that's that resisting change business, kind of do it.
Right. Now I have so many questions, and I know I can only keep it for so long, but I really do want to ask you about the work at home thing, because even with friends that are not involved in dentistry, some of them have 6 floors of real estate and they're trying to get rid of 4 of them. All bets are off now. Everyone's thinking about how to have a better life now. How can I really utilize the potential of working at home? Give us a scope of this, or a couple. What are some of the most creative things you've seen from dentists working at home?
Yeah, and it all evolves from this other stuff. If I can have an online form, I don't have to have a staff person in there handing the patient a clipboard. So it's really, that's why I started with the digital workflow in the office, because it translates easily to work from home. And by the way, that's another thing I wanted to ask you, because one of the things I've been reading, but again, you have more daily contact with the offices, is with the dealing with the pandemic, the dentists have a pretty good handle on the science of it, and they're comfortable with the PPE and covering themselves and the extra sterilization, but their staff members are more reluctant to go back to work. That's what I've read, and that's what I've experienced so far. Have you found that to be the case or not?
Well, here's the thing. Now, again, everything I'm going to give you is probably anecdotal or biased, because I'm watching what the best do. Now, all you have to do is watch a movie like Social Dilemma. I don't know if you've seen that movie, but it'll frighten you enough to know that we don't often know as a public what's true or not. Now, let me answer your question specifically. Our best doctors that had their team members came back did the best effort they could daily to truly educate their team on what the virus was. Our worst were subject to team members going, I watched a YouTube video or I saw on Facebook that they didn't let the world go crazy. And I also think our best docs did a great job of really informing patients of what the disease was. They were downloading things daily from the CDC or the ADA's website saying, that's not factual. Here's the latest data on what this was. Because you know this, Larry, the people that didn't know what this virus was were losing their minds.
Oh, yeah. And it's just sadly, some people haven't caught on yet. Now we have, at first it was like, we think this might be the case. This is our, not speculation, but what we think might happen. Now we have data. We know what did happen. And some of the things that we were worried about at the beginning, you don't need to be worried about. But people are still, anyway, that's a whole nother issue.
Right.
Yeah.
But I think the important thing is just baby steps, and like, it's no different than, you've got to be heavily invested. Number one, your most important thing in your practice marketing is your people, your team. You start there, whether it be education or facts, and then how do we disseminate that information or communicate, whether it be digital dentistry, telemedicine, whatever, it goes through the team. So, I'm probably not the right person to ask because I have a lot of thoughts in this, but I also know that dentistry is an incredible profession. And I've been doing this for 25 years. You've seen it better than I do. As people adapt, they do better. The people that went to paperless charts earlier go, oh, it was hard a little bit, but we got through it. It's so much better now.
Oh, yeah.
So I think you just got to be open as a dentist because the future is incredible. Now, again, I have so many questions. Larry, you get to see so much stuff. What are we going to expect in the future? You gave us a little glimpse, but it's anyone's guess. What's the future of technology look like in dentistry?
Okay. Let me finish answering your last question and then talk about the future, because the future.
I don't even remember my last question. I had a lot of them in there.
What are you going to do working from home?
Oh, there we go. I have.
So this is mostly for team. Dentistry, we're going to be doing more work from home, and the dentist can work from home now. The dentist can do treatment plans from home. The dentist can write notes from home. The dentist can do referrals from home. The dentist can review x-rays from home. The dentist can do all that stuff from home. When you have to actually put your fingers in the patient's mouth, of course, we still need to do that. But that's coming. Actually, we're going to have robot dentistry sometimes. Staff members, though, there's so much you can do from home. You do not need to be sitting at a desk in a dental office to answer the telephones. Everything you need to answer that phone, the schedule, the patient's chart, their history, the lab, everything you need to schedule or whatever, answer the phone for any reason, you can have on your computer. And so you can answer the phones from a different country. You don't need to be sitting at the front desk. So you can do that from home. So you can do scheduling from home, answering the phones. Bill pay, we mentioned that already, online bill pay. You don't have to be there answering the phone or paying things. I'm trying to think of some other things, online points, pulling charts. I think I've covered most of those things, but that's what we can do with work from home is our team members don't have to be in the office unless we're actually putting our fingers in the patient's mouth. And there's so much of the business side of dentistry that can be done that way. Now, you asked me let me do one little thing and then we'll talk about the future.
Go ahead.
Let me grab my little notes here. This is, it goes back to what I talked about earlier about that practice technologist and the team member of the past, team member of the future. And this is just a little thing I put together. Let me just go this through real quick. So if I have a paper record compared to a digital record, like paper practice, digital practice. So what do I have to do? Well, I have to pull charts. That takes about 20 minutes a day. I don't have to do that. I look for the loss chart. The daily ritual, the loss chart every day. That's 15 minutes. So that never happens. I have to call to confirm. That takes 40 minutes a day. The e-service does that. Check my eligibility. E-service can do that. Enter the data from the forms. Type in. Don't have to do that. We do online forms that sync. Do a chart, draw my little red circles around the teeth. I don't have to do that, just have to click. So it takes a few minutes to do that. Write my notes, I have to do that, simply click. Take payments over the phone, don't have to do that online bill pay. Replace the charts at the end of the day. No, you just go home. So my little listing of all this stuff is about 220 minutes a day that you do this stuff compared to 20 minutes electronically. That's 11 to 1.
No brainer.
Does that mean, doctors, you can hire one person for every 11 people you have now? I'm not going there. but it certainly means you can be more effective with less staff when you do electronic services. But that staff person has to be not a phone answerer. They have to be a practice technologist. Who adds more value? The practice technologist does.
That's brilliant. That's
okay.
brilliant.
I'm sorry. I should have told the staff members to stop listening. You can come back again.
That's all right.
Well, just become the practice team members, become the practice technologist, become the MVP, the most valuable person in your practice. That's how you do it. Okay, I'm done. I'm done with that. Let's talk about the future.
Well, here's one thing I'll just add. I think what you said is brilliant because everything you're adding up, I'm doing the time calculations. I turned 50 during the pandemic. And one of the things I've known as I've gotten older is like, wow, I could be playing the back nine. Time is the secret. You know, like you want more time. You don't need more money when you get into your 50s. I mean, it's always nice to make money, but you want to it's time. You start valuing time at a higher level. And so the best I've ever seen really understand the variables of time. And so the technology gives you the keys to do what you want to do. And we're going to be talking about what you're doing next, which is on your desk, but we're going to save that for it. Go back to, I want you to answer the question, well, as best you can, because you get to see the cool stuff in dentistry. What's the future look like with, digital dentistry, telemedicine, or technology in general? What are you seeing?
Well, I see an integration of all these things right now. Right now, dentistry, medicine in general, but dentistry in particular, are lacking in integrated processes. It's hard for one cone beam machine to read another cone beam's images. It's impossible. This is ridiculous. It is impossible to transfer an electronic record of one patient from one office to another. I can't even go from Dentrix to Dentrix, let alone Dentrix to EagleSoft. It's just impossible. There's no standards. But as these things become interoperable, then we'll start transferring more of these types of things. And so we'll be doing more digital consultations and those kinds of things, transferring between specialists and dentists, more electronic records. There are already several apps available to do telemedicine with the telephone. I take a picture of my teeth. I transfer it to my dental office. They can review the teeth. Now, of course, you can't stick an Explorer in it, but there's a lot of things that you can do. So those are the things we're going. So I think there's three things that are really going to define the future. We talked about one of them, which is telemedicine. And again, most of the things I'm reading are more on the medical side than the dental, but dentistry always follows along. We'll be getting there. And the other part of that makes that so interesting is AI. I mentioned that already, artificial intelligence. It is staggering what's being done in the medical field. Artificial intelligence works best in pattern recognition, like examining an X-ray, examining, like I mentioned, the photo of my lesion, those kinds of things. Those kinds of diagnosis are already being developed. There's amazing apps being developed to help people with mental counseling, getting rid of psychologists. Anyway, to find out about it, you need to read the book called, I'm halfway through it, Deep Medicine by Eric Topol, T-O-P-O-L, Eric Topol. He's written two books. The first one I read that kind of set this up for me, it was about 10 years ago, and it was called The Creative Destruction of Medicine. He's actually written three. The latest one is Deep Medicine, and it goes over all this stuff. He's a good writer, and if you're a geek like me, you'll just love it. So, and it talks about all this stuff where we're seeing this coming from. So, telemedicine, and by the way, that telemedicine has great uses for clinics and for hard to get to people up in the middle of Alaska somewhere. They can sit in front of a computer with maybe a paradental person there that can kind of do some of the examination. You send it down to a real dentist somewhere in, I don't know, California. They have dentists in California? That's been questionable. Anyway.
There are some really great ones.
Okay, good. You're kinder than me. Anyway, and then send it back. So I'm getting rough. The last one that I think is going to change the future completely is 3D printing. And again, we just begin to see the beginnings of that, but printing mouths, printing temporaries, I saw this amazing thing done in South America where they printed a replacement jawbone for this man in a horrible accident, all done electronically and digitally as well. So anyway, that's the future in my opinion, telemedicine, artificial intelligence, and 3D printing.
Yeah, I agree with the printing is unbelievable. I still can't get my brain around that one too. So Larry, this is awesome. And I want to have you back again and again, but I think a couple things. Number one, people have to read your blog. Like I've been reading your blog for years. You are totally an expert on, technology and what's on the forefront. How do people read your blog for the benefit of people listening on iTunes? How do I find out more about what you do?
Thank you very much. I appreciate that. And it is a labor of love. I love doing it. And many of the things we talked about today, like the books, the telemedicine thing, some of the future focused things are in there, as well as practical ideas, things I can do tomorrow in my practice. So the blog is simply Emmott on Technology. So my name is Emmott, E-M-M-O-T-T, which is the proper spelling. Some people spell it with an E. E-M-M-O-T-T on technology.com. And you can visit it on a daily basis, but it's really better just to subscribe. So up in the right-hand corner, a little subscribe button, just hit that and, type in your email address. You'll get I add to it almost every day. And you get one you're interested in, read it. If you don't, just delete and subscribe. Emmott on technology.com.
Okay, so I just put it on the screen. I hope I said that. Emmott on technology.com. So you can check it out there. We'll put it in the show notes too. And so, Larry, I really, really appreciate this. Any last words you have for these three important topics as we close out with our listeners?
Well, again, visit the blog. I hope you'll find it to be valuable. And remember, when you're dealing with the change and the challenges that some of those team members have, it's not necessarily, remember that loss of status thing. That's huge. It's also from the dentist as well. Oh, one last thing. What? My newest hobby. I'm just loving this.
Oh, wait. We forgot. Yeah. Tell them about what you're doing. I forgot about that.
This is a little, I've being a dentist, I always was good with my hands. I've taken up sculpture. Actually, as a young man, I wanted to be an artist, but my mother convinced me I'd make more money as a dentist. So I practiced dentistry for 30 plus years, but then I got back into art and I love mountain biking. I mountain bike all the time. And so I started making mountain bike sculptures. So they're available as well. I make them for fun, but they are for sale. There's another one over this corner. You can see that guy that fell over the front bars.
So do you sell them on your website or your blog? What do you do?
I have a separate website for this. It's Larry Emmott Art. So again, my name, Larry, E-M-M-O-T-T, art, A-R-T.com. Larry Emmott Art. So anyway, it's something I'm having a great time with. So.
Yeah, buddy, I always enjoy my time with you. You're just a great thinker. I want to have you back again and again. We'll talk about stuff, but thank you so much for sharing your thoughts today. And there's no doubt those are huge opportunities in dentistry. And if you're struggling with how to do it, Larry's a hugely helpful, supportive guy, and his email's in there. Just check it out. So thank you again, Larry. So stick around while we say goodbye to everybody else. But thank you guys for tuning in and watching the Best Practices Show or listening to the Best Practices Show wherever you're consuming podcasts. I want to thank you guys. If you enjoyed today, just do me a favor, hit the share button, share with your friends. Keep sending us suggestions for things that you want to see in the shows. I got a bunch today. And if there's things you want me to ask Larry, we're going to bring him back and I'll dish him the tough questions and let the experts answer them. I'm so happy to do them. And until we see you next time, keep watching the Best Practices Show. You guys enjoy the rest of your day. All right, we're out. That was easy.
Yes.
Awesome. That was awesome.
We covered so much. I talk so fast, and yet there's so much more.
No, you're picking up my jam. Like I just love to have a little fun, educate them, make it a little funny, whatever it may be. Learning's got to be fun. So I just enjoy this, buddy. Well, let's do another one in like 6 weeks. You pick the topics. I don't even care. But I always love like some great learning, whatever. Like if you have a thread, you're like, let me talk about the ins and outs of this. And then we'll just keep doing a call to action. What do you think? Okay. I like that. Yeah. Let me give it some thought. Because what I just did is kind of my big shtick now. There's details we didn't get to, but that's what I've been really, the other one that really is popular on the lecture circuit is using the internet effectively, using Google. Completely different thing, but that's an area that there's a lot of misinformation about. So that might be fun. Hey, could you do one on that? Let's do a whole podcast on that one. That'd be awesome. I don't know the first thing about it. It's way over my head. So, well, let me put it this way. Again, there's a lot of misinformation. So it's awesome. All right, buddy. The other topic that's hot right now is digital security. So those are the three ones that I've been talking about for the last year. So this one, workflow, Google, and I want to say HIPAA, but it does include HIPAA, but digital security. Gosh, there's a lot of issues with that. So anyway, those are three possibilities. Let's do it. Let's do it. Awesome, buddy. Well, you have a great weekend. Good to see you.
Thank you. Thank you. Take
All right.
care.
Take care, buddy.
Bye-bye.
Bye.